I totally reject the propaganda of the anti-vaxxers. They're wrong. Vulnerable people, people who need a vaccine, should definitely get a vaccine, and everybody should get a vaccine as soon as it is available, according to the advice of the JCVI, the Joint Committee on Vaccination and Immunisation. We should be very, very pro vaccine. On your sort of your idea about I think perhaps there's a confusion. What we're suggesting is there might be an interrelation between the tiering structure and the mass testing, and there I think there is the potential to encourage people to get a test as a community and work together to squeeze the disease, as Liverpool did, and that was it's been really encouraging to see how the people of Liverpool really came together. Large numbers took tests. We would like to see even bigger proportions of communities taking these lateral flow tests to establish whether or not they're infectious, because we think that could be a way of isolating the positive cases, helping to drive down the rate of infection, and so helping that area, that community, to move down the tiers to get rid of some of the restrictions. I hope that's clear. So it's an interrelation between the tiering and getting a test to squeeze the disease.
Shall I just start off on the vaccination? But I think Andy will want to add on this. I mean, in the first instance, the data so far is about whether the vaccine protects the person who has been vaccinated, both for this vaccine and for other vaccines. And you're absolutely right that no vaccine will be 100%, or almost no vaccine will be 100% protection. There is then a question, but that's very important, and that will significantly reduce if these vaccines come through the regulators and once they're in people's arms. This will reduce the number of people who die, the number of people with severe disease, the number of people going to hospital very significantly if we get good take-up. Then there is the possibility that any of these vaccines, and indeed new ones coming on, because there are many other vaccines coming through the system, including ones being trialled here in the UK, may actually protect people around the person who's vaccinated, because they make it very unlikely that person will either get infected or will pass it on. We don't know that yet. There are some early hints that might happen, and for some infections it definitely does happen. But we can't say that for sure. And if that's the case, then getting a vaccination not only protects you but it also protects your family, your friends, your work colleagues, those around you. But we cannot say that at this point until we have more data. But I think I would like to also just reiterate a point the Prime Minister has made. It is absolutely the case that either way, my advice would be, any medical practitioner's advice would be, these should be voluntary vaccinations, and people should want to take them because they will protect them from a potentially very debilitating and in some cases sadly fatal disease by these vaccines. But I think we need to be clear that there is this additional use that might come through, and Andy has got some early data on this from their vaccine.
Yeah, I certainly agree with the point that none of the vaccines are likely to protect everyone. But one of the interesting features so far across all of the different vaccines is they do seem to have stopped hospitalizations and severe disease. We only have limited data from press releases so far, but that's really what it appears to be. So it may be that the thing that we're really after, which is going back to the initial slogans about protecting the NHS, it may be that all of the vaccines can do that. What is harder is to prevent milder disease. And of course, most of the people in all of the trials that are being done have these slightly milder infections, which is the bit that we can measure the most easily because there are more of them. So when we see the efficacy levels, it is a mixture of dramatic impact against severe disease and slightly less dramatic impact against the milder disease. But all of the vaccines have high efficacy. The hint in the data, there's just a little hint in the data from ours, because we have this amazing setup here in the UK where we've been able to swab over 8,000 people in the trials every week. And so we can also pick up the cases of asymptomatic infection. And there's a hint in the data that in one of our groups that had the higher efficacy, we were able to reduce the amount of asymptomatic infection. And that may mean that there could be fewer people in the population who are spreaders. and that starts to stop the virus in its tracks if we can get there. But it's only a hint at the moment, and we need more information.
Thanks, Andrew. That's incredibly and possibly encouraging. Thank you. Paul Waugh, HuffPost.
Evening, Prime Minister. You've announced today that the funding for Test and Trace will increase to £22 billion a year. That's equivalent to a fifth of the entire annual NHS budget. Do you think the current service offers anywhere near a fifth of the benefits of the entire NHS? And can you say how much of that new money will go on tracing as opposed to testing? And will the bulk of the tracing money go on local public health tracers rather than lining the pockets of private sector firms like Serco? And one for Professor Whitty. Public Health England suggested last week that for every 1 day of relaxation over Christmas, there could be 5 days of fresh restrictions. Have you got a current best estimate for what that ratio might be now? And have SAGE modelled the increase in cases and therefore deaths in a worst case scenario that could occur as a result of the loosening at Christmas?
Thanks, Paul. I'm just going to go back to some stuff I've been saying to you and to many others over the last few months about NHS Test and Trace. Yes, of course, a new operation like this, is going to have teething problems and difficulties, and there's no doubt that it has. And of course, people have been frustrated sometimes by the service that they've got, and I recognise that. Of course, I do. But look at what it is now achieving: a capacity of 500,000 tests per day. It's conducting hundreds of thousands of tests, and 37 million tests have now been done, more than any other European country. And you're right to raise the issue of collaboration with local authorities. That's integral to what we're doing, what NHS Test and Trace is doing. I think there are 198, something like 198 local authority teams. And as we go forward, the work of local authorities and others, we've mentioned the armed services, Public Health England and so on, will be crucial. I just want to stress, you say, is it value? It's of such importance and such value, because if we don't have it, we can't know where the disease is prevalent in the way that we do. We have fantastic granular detail, which enables us to have this tiering system, this regional focused, locally focused tiering system that we've got. And it enables people who have symptoms to get a test and find out whether they've got it or not, and thereby to take themselves out of circulation. That's absolutely crucial. And the point we're trying to make this evening is that we can see the light at the end of the tunnel, but we're not there yet. We can see the oasis, but there's a long way to go. I mix my seasonal metaphors. There will be hard months ahead. We're going to rely very much on testing and tracing, and we're going to ramp that up. And the PCR testing is invaluable. The LAMP tests in NHS settings is also absolutely crucial to drive down infections in hospitals, nosocomial infections that played such a part in the spread of the disease in the spring. And of course, there's the whole lateral flow testing, the rapid turnaround tests, that I also think can be of great value. Now, it would be a huge mistake now for us to de-emphasize testing at this crucial moment. If anything, we want to put more emphasis on testing, encourage people to get a test. Get a test if you have symptoms, get a test in your community if it's a high prevalence area, and help to squeeze it.
On Christmas, the thing I would add to what others have said is it is pretty obvious, I think, to anybody that the Christmas holiday period, the loosenings around that, which I think everyone welcomes as an ability for families to come together and all the things that go with the winter period, we all know that is going to come at a risk. And the amount of risk of it depends on really three things: how seriously people stick to the tiers before we go into Christmas, making sure we keep the numbers keeping on coming down or stabilised at a low level, that people over Christmas take the opportunities but take them incredibly responsibly, and then they're coming out of the Christmas period. Again, people take this next period, which the Prime Minister's talked about, the period out to spring, incredibly seriously, and again, we are very mindful of the fact that if we start breaking all the rules, then we are putting other people at risk at a point of the year when these viruses transmit most easily and when the NHS is under greatest pressure. So it is absolutely essential people are really serious about this. In terms of putting a number on it, to be honest, I wouldn't put a number on it, because if people do all those things very seriously, we will have much less impact from Christmas, whilst people still being able to enjoy it, than if people choose to actually take a very much less public-spirited approach to it and go wild over that period. And so I think what we really need to do is we need to say, look, if everyone is serious before, during and after, then we can minimise the amount of impact it'll have. Of course, it will have an impact, and that's accepted. And this is all part of the balance of having to keep the virus under control, but trying to do so in the way that is the least socially and economically damaging. It's a very difficult balance, as we all know, for which there is no perfect answer. It's trying to get the balance as best we can between these competing difficulties.
Thanks so much. Thanks, Paul. Let's go to Talk or Crichton, the Daily Record.
Good evening, Prime Minister. What is the score of the Christmas holidays? Final agreement seems to be stuck in a kind of no man's land between you and the devolved governments. Nicola Sturgeon wants a small number of people to meet for a small number of days. Fewer days than you, perhaps. Is the devolved tail wagging the Westminster dog here? And what are the chances of a bit of peace and goodwill between the two of you?
Well, Talk, I think there's, as ever, the absence of peace and goodwill is grossly overstated by those who might have reasons to do so. Actually, there's a very good discussion going on between us and the DAs about how to do this. It obviously has relatives in all parts of the country, and we want to make sure we have a solution for Christmas that everybody can share and understand and respect throughout the whole of the UK. But to get to your characterisation, I think everybody shares your caution. We want people to be able to celebrate, but we don't want to ruin it by overdoing it. So that, I think there's a wide measure of agreement about that, and I think you can probably expect some news about the way forward pretty soon. Talk. Okay, everybody. Unless there's anything that anybody wants to add, I think.
Prime Minister, can I just add on that last one?
Sorry.
I have the privilege of working very closely with my opposite number chief medical officers from Scotland, Wales and Northern Ireland. And in fact, the last meeting I had before this press conference was with them to discuss Christmas. And we learned from one another. That's what it is. It's all about us learning from one another and actually bringing the skills across the UK to bear to actually learn about this virus and try and achieve the best outcomes for the public.
Thank you very much. Thanks for what we're all doing. Thank you all. See you next time. Thank you.
A kind of no man's land between you and the devolved governments. Nicola Sturgeon wants a small number of people to meet for a small number of days. Fewer days than you, perhaps. Is the devolved tail wagging the Westminster dog here? And what are the chances of a bit of peace and goodwill between the two of you?
Well, Talk, I think there's, as ever, the absence of peace and goodwill is grossly overstated by those who might have reasons to do so. Actually, there's a very good discussion going on between us and the DAs about how to do this. It obviously has relatives in all parts of the country, and we want to make sure we have a solution for Christmas that everybody can share and understand and respect throughout the whole of the UK. But to get to your characterisation, I think everybody shares your caution. We want people to be able to celebrate, but we don't want to ruin it by overdoing it. So that, I think there's a wide measure of agreement about that, and I think you can probably expect some news about the way forward pretty soon. Talk. Okay, everybody. Unless there's anything that anybody wants to add, I think.
Prime Minister, can I just add on that last one?
Sorry.
I have the privilege of working very closely with my opposite number chief medical officers from Scotland, Wales and Northern Ireland. And in fact, the last meeting I had before this press conference was with them to discuss Christmas. And we learned from one another. That's what it is. It's all about us learning from one another and actually bringing the skills across the UK to bear to actually learn about this virus and try and achieve the best outcomes for the public.
Thank you very much. Thanks for what we're all doing. Thank you all. See you next time. Thank you.